First of all, I would like to thank our respected MS Madam and our respected Deputy MS Sir for giving me an opportunity to create an awareness in the head and neck cancers. So coming to the head and neck cancers, first of all, I would like to introduce myself. I myself, Dr. Maibam Puspakishore presently working in District Hospital Churachandpur as ENT specialist, and my super specialization is in head and neck cancer. I would like to give a brief introductions about the head and neck cancers, because the head and neck cancers, it's one of the most common cancers in our country. Head and neck cancers includes a variety of cancers that arises from the airway and the food passages. Apart from that airway and food passages, it also arises from the nose and the paranasal sinus. And most of these cancers are the squamous cells type of cancers, which is a variant of the head and neck cancers. And this type of the cancers are associated with tobacco and the alcohol uses. So I just want to emphasize here, the tobacco is one of the most important culprit for causing the head and neck cancers. Apart from this variant of the head and neck cancers, there are also some other head and neck cancers which are not of squamous cell variants, and this includes your thyroid cancers. Thyroid is an important endocrine gland which is situated in the lower part of the neck. And another important cancer is the salivary gland cancer. The salivary gland which is responsible for the productions of the saliva. Coming to the incidence and prevalence of this cancer, the head and neck cancer is the 6th most common cancer worldwide, and it accounts for 3% in United States and 4% in Europe, but more than the total 55% of the head and neck cancer is in the Southeast Asia. When we see in the India scenario, of all the cancer in India, 30 to 40% of the cancer is formed by the head and neck, and out of this total cancer, that is 30 to 40% of the head and neck cancers, more than 50% of the total cancers are in the northeastern states. That means the prevalence of the cancer in the northeastern states is very high. And according to the latest ICMR report, that is the Indian Council for the Medical Research, Nagaland is the state with the most common for the nasopharyngeal cancer. Now coming to the causes and the risk factors for the head and neck cancers. What causes head and neck cancers? We need to know, and this is very important. As I have already said, tobacco uses is the main causes of the head and neck cancers. More than 90% of the head and neck cancers are the squamous cells variant, and this is associated with the tobacco and the alcohol uses. So the alcohol is an important risk factors, but it has got synergistic action, means it increases the cancer of the effect of the cancer that is caused by the tobacco. So before coming to the alcohol, I would like to describe a brief about the tobacco. The tobacco uses is very common in our northeastern states, and we use tobacco in the form of smoking. That is like we used to smoke, and smoking tobacco contain more than 30 non-carcinogens. More than 30 non-carcinogens, and some importance to mention are polycyclic aromatic hydrocarbons. And in addition to this, the tobacco contains an important addictive substances that is called nicotine. Nicotine itself doesn't cause cancer, but it has got an addictive actions. And one form of the tobacco is the non-smoking form. That means we use tobacco in the form of chewing. That can be in the form of pan. It can be in the form of khaini, or it may be in the form of gudkha. So this tobacco means is an important risk factors for the development of the head and neck cancers. And this tobacco also causes pre-malignant lesions. Pre-malignant lesions means it causes a certain conditions in which the patient is in the pre-cancerous states, in which the tobacco replaces the normal mucosa of the oral cavity, and it's replaced by a fibrous tissue plaque that is prone to the development of the cancers. If we don't stop the use of tobacco at this stage, then at one point of time the patients will definitely going to develop cancers. So this is about the tobacco, use of tobacco. The another one is the alcohol. Alcohol itself doesn't cause cancer, but it has got synergistic actions with the use of the tobacco. That means when we use the tobacco along with the alcohol, then it increases the risk of the head and neck cancers by 3 to 4 times. So these are the two important causes of the head and neck cancers. The other important causes of the head and neck cancers is it's certain viral infections like human papillomavirus, like Epstein-Barr virus, which is known to causes the oropharyngeal and your hypopharyngeal cancers. These oropharyngeal and hypopharyngeal cancers, these are the part of our food tracts. Our foot, in the anterior part of the neck, there are two tubes. One is the tube for the airway, and just behind that one, there is the tube for the passage of the foot. And that passage of the foot, that the foot tube, that tube for the foot is divided into 3 parts according to the site of their locations. The part of the foot tubes that is located behind the nose is called nasopharynx. And the part of the foot tubes that lies behind your oral cavity, that is called the oropharynx. And the part of the foot tubes that is located behind the larynx, which we commonly known as the voice box, that is called the hypopharynx. These certain viruses causes the cancer of our foot tubes. That is the to be very specified, it causes the cancer of the nasopharynx and the oropharynx. The certain other causes of the head and neck cancers is the occupational exposures. The persons who is working in the chemical factories, the persons who is working as a car mechanics, or the person who is working as a wood carpenters, these are exposed to these dust particles, and they are also at the risk of the development of the head and neck cancers. Apart from that one, the other causes of the head and neck cancers are dietary habits. Those people who are consuming less fresh vegetables, less fruits, and consuming high red meat contents, they are at the increased risk of the development of the head and neck cancers. So we need to emphasize increased consumption of the red meat increase the risk of the head and neck cancers. So we need to increase the intakes of the fresh vegetables and the fruits. And the persons with the sedentary lifestyles, it's also at the risk of the development of the head and neck cancers. The other causes, which is not much important, but it is relevant, certain genetic causes is there, but it is not that much common in the head and neck cancers, but it is common in the thyroid cancers. In the thyroid cancers, there are certain variants of the thyroid cancer that runs in family. To be very specified, medullary thyroid cancer, it's a type of the thyroid cancers in which we have found the family history of the cancers. Then comes the immunological effect. Immunological effect means the persons in which the immune systems of the body is decreases. For example, the patient infected with HIV, or the patient which is receiving immunosuppressive drugs for the renal transplants or for the liver transplants, these patients are at the increased risk of the development of the head and neck cancers. And it has also been found that in the patients with the history of the chronic gastritis problems, there is also the risk of the development of laryngeal and hypopharyngeal cancers. So this is about the causes and the risk factors for the development of the head and neck cancers. Now coming to the presentations, how a patient with the head and neck cancers will present to the doctors. So this presenting complaints depends upon the site of the locations of the primary tumors. That means the signs and symptoms will depend upon the primary tumors where it's been located. To be briefly summarize the signs and symptoms, for example, a cancer of the oral cavity. The oral cavity includes your tongue, your lips, your mucosa, your cheek. So a patient of these cancers may present with a ulcer. Normally, a simple ulcer in the mouth usually heals in maximum 7 to 10 days. But if there is an ulcer in the oral cavity, which is not healing for more than 2 to 3 weeks, and if it is associated with the bleeding, and if it is associated with the burning sensation in the mouth, and if it is associated with the difficulty in opening the mouth, normally we can insert our 3 fingers inside our oral cavity. But in the patients with the chronic tobacco users, they have restricted mouth opening. So in this, it is because of the effect of the changes caused by the tobacco. So in that cases, we can suspect for the development of the cancer, especially in those patients which have a history of the uses of the tobacco. So these are some of the presenting complaints of the mouth cancers. Whereas in the nasopharyngeal cancers, as I've said, nasopharynx is a part of the food pipe which is situated behind the nose. And this nasopharyngeal cancer is most common even in Manipur. Nasopharyngeal cancer is common in the hilly areas because the habit of eating the roasted meat, here in the hilly areas, we have got the habit of burning the meat, and we used to consume that one. So by the burning of that particular meat, that is covered by the carbon particles, and it contains an important carcinogen that is called the nitrosamine. So that kind of cancer is common in those people which has got the habit of eating this roasted meat. Apart from that one, the burning of the pine woods, the smoke of the burning of the pine wood when we consume, when there is a poor ventilation in the house, when we inhale that smoke also, then there is increased risk of the development of the nasopharyngeal cancers. In that cases, the patient may present with nose block. The patient may have fullness sensation in the ear. The patient may have the tendency of bleeding from the nose, and in some cases the patients may develop a neck swelling. So in that cases we should suspect these cancers. The other cancers, for example, for the oropharyngeal cancers, the patient may have presence with the difficulty in swallowing, which may be initially for the solid food, but gradually as the size of the tumor increases, the patients may complain even difficulty in swallowing for the liquid foods, but at one point of time, the patients may feel difficulty in swallowing his or her own saliva. And there may be referred pain in the ear. Referred pain is like, the cancer may be in the food pipe, but because of their common nerve innervations, the patient may be radiating to the ears. So this is some of the common presentations of our food pipe cancers. Now coming to the laryngeal cancer, that is called the voice box. It is most common among the smokers, and it's most commonly seen in the age group of around 40 to 55 years, as the incidence of smoking is more common in the male than the female. So definitely this cancer is more common in the male. In this cancer, the patient may present with the change in voice, or there may be hoarseness of the voice. Gradually, as the size of the tumor increases, the patient may develop difficulty in breathing. So at one point of time, means that the patient cannot even lay down, and they present in our emergency with severe respiratory distress. So these are some of the presenting signs and symptoms of our laryngeal cancers. Now coming to the thyroid cancers. The thyroid cancers is also common in in the northeastern states, especially in Manipur and Arunachal. So there are different variants of the thyroid cancers, and these thyroid cancers is commonly seen in the female compared to the men, the ratio being 3:1, and the age group most commonly affected is around 40 to 50 years of age. So in these patients, the patient usually presents with a swelling in the anterior part of the neck, in the lower part of the neck, which the patients presents to us by incidental findings, or when one of her relatives inform her that there is a swelling in the neck. So this is the most common presenting symptoms of the thyroid cancers. And the thyroid cancers, the thyroid cancers rarely presents with other symptoms. Of course, in the advanced stages, it may present with the change in voice, or with the difficulty in the swallowing. So thyroid cancers has got mainly divided into 4 variants. The most common one and the best prognosis is your papillary thyroid cancer. It's a variant of the thyroid cancer which has got the best prognosis, in which the patient survives for 5 the patient survivals for 5 years is even more than 95%, even if we don't treat the cancers. But it doesn't mean that we should ignore the cancers. If they have got such swelling in the neck, then they should consult with their respective doctors, and we should rule out the cancers. But one good thing is, like, of 10 persons patients presenting in the OPD with the thyroid cancers, only 1 patient used to develop the cancers. So this is about the thyroid cancers. And another cancers which is important in the head and neck cancer is your salivary gland cancers. Salivary gland cancers, it's also the exact causes is not known, but we have found that in some patients which are the smokers, or if there is a history of radiation exposure, so in this kind of patients they may develop some kind of salivary gland cancers. The most common being your parotid gland. It's a gland that is responsible for the productions of the saliva, and it is located between your ear and this jawbone. So this is about some of the signs and symptoms of the different type of the thyroid cancers. Now I would like to come to the detections and the diagnosis of these cancers. Most of the head and neck cancers, when they present in the advanced stage cancers. It's very difficult to detect them in the early stage cancers because they hardly produce symptoms. So in any cancers, for the head and neck cancers, we divided them into 4 stages. Stage 1, Stage 2, Stage 3 and Stage 4. The Stage 1 and the Stage 2 cancer are considered to be the early stage cancers, in which if we have detected them in the early stages, then the prognosis and the outcome of the cancer, and of course their survival is good. But if the patients present in the Stage 3 and the Stage 4 cancers, the outcome is not so good as compared to the early stage disease. So regarding the detections and diagnosis, as I've already said, early detection is very difficult. It's very as the patient hardly produce symptoms. Of course, there are with the advancement in the medical science, we can use certain optical imaging technique, in which we passes a light over the suspected area, and we can detect the cancer cells with the use of the narrowband imaging or focal contact endoscopy. But in the developing countries like ours, especially in Northeast, these facilities are not available till now. And suppose if there is any obvious growth in the oral cavity, then we can take a biopsy, we can take a punch biopsy, and we can send for the histopathological examinations to rule out whether it's cancer or not. And if there is any important neck swelling, then we can insert a needle and we can do the test. That particular procedure is called the FNAC. Here I just want to emphasize a little about the swelling in the neck, the importance of the swelling in the neck. Most of the oral cavity cancers will be detected on the left side, because we got the habit of putting the chop tobacco on the left side, and that also on the lower part. So if a patient develops cancer on the left side and At the same time, if there is a neck node on the same side, then after doing FNAC, that neck node has been confirmed to be a spread from that primary tumor, then the chances of the survival is reduced to 50%. That means a patient having the cancer just in the oral cavity without the neck involvement, without the neck swelling, and a patient with the cancer in the oral cavity with the neck, with a confirmed this one metastasis in the neck, then the chances of the survival is reduced to 50%. That means if a patient survives for 10 years without a neck node, then with the appearance of a neck node, the chance of survival is reduced to 50%. If a person is living for 10 years, then if there is a confirmed neck node metastasis, then the chances of that 10-year survival is reduced to 5 years. And that neck node, suppose if the primary tumor is on the left side, and if there is development of a neck node on the right side, that 50% is again reduced to 33%. That means the cancer has been spread to the neck. And one of the main treatment failure of the head and neck cancer is the spread into the neck. That is called the regional spread. So any neck swelling should be given emphasis, and they should take the consultations of the particular doctors which is expertise in the head and neck cancers. And apart from these two investigations, we can go for upper GI endoscopy, because there is a particular term that is called the field cancerizations. That means a patient with a head and neck cancers can develop cancer in the whole upper aerodigestive tract. That is, they have the chances of development of the cancer in the upper airway and the food passages. If a patient of oral cavity cancers, a patient with the oral cavity cancers may also develop cancer in the food pipe, in the lower food pipe, like the esophagus. So if we don't detect these two primary cancers together, and if we miss the second tumor, and if we treat only the primary tumors, then the prognosis is very bad. And when these two kind of tumors simultaneously, if two tumors appear at two different sites, then the prognosis is also very bad. So and these chances is around 5 to 10% in the head and neck cancer. So any patients with the head and neck cancers, we have to rule out the second primary tumors in the other part of our airway and the food passages. So for that one, we have to go for an upper GI endoscopy, and after that, if there is any obvious growth, then we have to take a biopsy from that particular area, and we have to send for the histopathological examinations. Apart from that one, we can go for certain imagings like CT scan or MRI scan, or even in the some advanced stage diseases, we can go for the PET scan to know the extent of the primary tumors, or whether the disease is just localized to that particular area, or it has been spread to the other part of the body. It also provides a map whether we will be able to do the surgery of the particular cancers or not. If we feels like the cancer has been spread to the lungs, the most common site of the spread of the cancer from the head and neck is the lungs. So a cancer of the oral cavity, if that cancer has been spread to the lungs, so there is no point of treating that primary cancers, because that cancer has already spread into the distant part of the body. So these are some of the methods for the early detections and the diagnosis of the head and neck cancers. And in the thyroid cancers, the most important imaging modality is the ultrasound. We do a basic ultrasound. We will do the FNAC from that particular swelling just to confirm whether it is cancer or not. And we do the basic thyroid function test. These are the three main functional tests that we do in the patient with the thyroid cancers. So coming to the treatment of the head and neck cancers. So there are various treatment modalities, and the head neck treatment is very complex. With only one surgeon we cannot treat that one. For any cancer patients, we used to have a tumor board in which the doctors from very expertise fields and from multidisciplinary teams, we deal a meeting and we give our expert opinions in which we give the best treatment modalities for that particular patients, and this treatment modalities depends upon the stage of the tumors. For the early stage tumor, that is the stage 1 and stage 2, we usually treat with one modality of treatment. That means we use a single treatment method for the treatment of the particular cancers. We can use either for the surgery or we can use for the radiotherapy. But for the advanced stage cancer, that is the stage 3 and stage 4, we use a multiple modality treatments. For example, for a cancer of the voice box, first we give the radiations along with the chemotherapy if the patients can tolerate the chemotherapy. Then after that, if the disease does not subside or if the disease recurs after the primary treatment, then we can go for the surgeries, or we can go for the treatment first followed by the radiations or chemotherapy depending upon the histopathological report of the patients. But in stage 3 and stage 4, as I've already said, we use a multiple treatment modality. Either we go for the surgery first, followed by the chemotherapy or radiotherapy, or first we go with the chemotherapy or the radiotherapy followed by the surgeries. So this is the treatment modalities. Now coming to the follow-up of the patients. Follow-up of the cancer patient is very important because most of the head and neck cancer recurs. That means even after the patient has been treated for the cancer, the maximum chances for the reappearing of the cancer is in the first 2 years of the completions of the treatment. That means if a patient has started treatment in 2002, if the patient has started treatment in 2020, then we have to be rigorously follow up the patients till 2022, because this is the period in which the patients will have the maximum chances of coming back of the cancer. So in that period, for the first 2 years, we follow up the patients every 2 to 3 months. Thereafter, the next 3 years, that is from the 3rd years to the 5th years, we follow up the patients for every 6 to we follow up the patients for every 4 to 6 months. Once the patients cross the 5 years, then we follow up the patients once in a year. But it is very important to emphasize that once a patient develops cancer, the chances of coming back of the cancer is always there. So we should follow up the patients till the patient survives. And the prognosis. The prognosis of the cancer treatment depends upon the stage of the cancers. If we detect the patient in the early stage cancer, then the prognosis is good. If we detect the patient in the advanced stage cancer, that is a stage 3 or stage 4, the prognosis is not good. For example, if we detect the cancer in the early stage, that is stage 1, the survival, 5-year survival is around 60 to 70%. But once the patient comes to the advanced stage, that is stage 4, this 60 to 70% survival reduced to 20 to 30%. So we should invest. So I just want to emphasize, we should detect the cancer at an early stage whenever possible. For this comes the roles of the preventive measures. In the preventive measures, for the prevention of the head and neck cancers, we should create an awareness among the public how the cancer is causes. As I've already said, tobacco is one of the most important culprit for development of the cancer. We should be given a strict rules against the use of the tobacco. Of course, the government of India has developed the COTPA Act 2000 for the discourage of the use of the tobacco among the younger age groups, where the generals less than 18 years are not allowed to buy cigarettes, or the patient or the person smoking in the private area will be fined. So these are some of the the ache of this tobacco control programs. So we should give the awareness of the causes of the cancers. We should emphasize, we should encourage the school-going children to avoid the tobacco. And this can be possible through the awareness, giving a talk on the televisions, by spreading the information through the radios, medias. So here comes the roles of the preventions of the development of the head and neck cancers. And there are certain preventable factors for the head and neck cancer. As I have already said, the consumption of the high amount of the red meat and decreased intake of the fresh vegetables. So in these cases, if we increase the intake of the fresh vegetables and decrease the intake of the red meat, then we should encourage the patient to be physically active. We should advise them to increase the intakes of vitamins like vitamin A, C and E, which has got a high amount of antioxidants. So this is the brief talk about the head and neck cancers, and I hope with this talk it will be able to reach to the people of the Churachandpur. And if any queries or if any confusion is there about this, then I will be always available in the district hospitals on Wednesday and Thursday. Everyone is welcome, and thanks to the GB TV channel for covering the telecast. Thank you.